Hello, my name is Melinda Frost. I'm a technical officer for risk communication and community engagement under the infodemics management pillar for the COVID-19 response of the World Health Organization. Welcome to today's webinar, Best Practices and Lessons Learned from an Interagency Perception Survey in the Asia Pacific. This webinar is part of a series from the Collective Service. And the Collective Service is a partnership between the International Federation of the Red Cross and Red Crescent Societies, UNICEF, and the World Health Organization, with support from the Global Outbreak Alert and Response Network. Communities, we all know, are key in stopping the spread of COVID-19, but it's only by understanding community and individual perceptions, how people communicate, what they know and what they don't know, that will enable us to help community-driven response in stopping the spread of COVID-19. Today, we'll hear about perceptions and risk communication and community engagement response in Myanmar, Malaysia, Indonesia, and Pakistan. Let me introduce Vivian Fluke, who's the coordinator for community engagement and accountability in the Asia Pacific. She's going to moderate today's session. Thank you.
Great, thank you so much, and a really warm welcome also from my side to all of the attendees. It's great to see so much interest in this subject, and I'm very excited to introduce you to our excellent panelists that I had the great pleasure to work with over the last months to pull together this really truly interagency effort. We will be hearing today from Georgian Novakovic, who is the consultant for strategic and risk communications at WHO Malaysia, Singapore, and Brunei office, Katie Bartholomew, who is the risk communication and community engagement consultant for UNICEF in Myanmar, from Audrey Y. Song Situ, who is our monitoring and evaluation officer for IFRC at the regional office in Kuala Lumpur, from Aga Safdar, our assistant director for PMER and community engagement and accountability at the Pakistan Red Crescent, and from Fajar Septian, who is the senior community engagement and accountability officer at IFRC in Lombok, Indonesia. So we have a really great round of people. I think in the audience there might be some more people that have been involved with this effort, and I'm hoping that they'll jump in to add to our discussion, as I of course hope that you all will do as well. We're going to start with a polling question that you will see pop up on your screen, and there will be a couple of polling questions throughout. The first polling question is, have you done a perception survey? Yes, no, not yet, but planning to give us a little bit of an idea of who has already kind of hands-on experience and who is perhaps planning to implement a survey. Great, so we can see that over half of you have not done a survey yet, so 55%, and 30% of you have done a survey, 16% haven't done one yet, but are planning to do one. That's really good to know. So I hope you'll be confident to ask all of your questions. Feel free to put your questions in the chat box throughout. I'm going to share my screen with you now. To give you just a little bit of context on the perception survey that we've rolled out as an interagency effort in Asia and the Pacific. I hope you can see my screen now. I'm going to keep this very brief because I think it's much more interesting to hear from the different countries. But for those of you who weren't at the last meeting and heard or saw our presentation from my colleague Husni from UN OCHA and myself, please, here is a little bit of an overview. So the survey that we're talking about today is an interagency perception survey in 4 countries, and it was led by WHO, IFRC, and several Red Cross, Red Crescent national societies, UNOCHA and UNICEF, and is mainly about 3 key areas. So knowledge and knowledge gaps of COVID-19 of communities, communication preferences, so trusted channels, etc., and stigma. And the survey was rolled out in Malaysia, Pakistan, Myanmar, and Indonesia. So overall, we had nearly 5,000 respondents, and the collection was quite mixed. Normally, we might not do that, but remember that during that time, which is now a few months ago, there were really heavy movement restrictions in most of these countries, and so we weren't really able to do a lot of face-to-face collection. All of the data went into a public interactive dashboard, for which you will also get the link when we send out this presentation, and you should have gotten a couple of links beforehand that is including the dashboard. And then we did the cross-country analysis, which means coding all the data, comparing the data points, adding and triangulating with other research, and putting together a cross-country report that has also been shared with you and will share again. And in addition, you can see here a couple of resources and tools for those of you who are planning to do a survey. We now have the second round of the survey imminent. Actually, last night, I finally managed to send out the final draft of the questionnaire. And now I'm really looking forward to this discussion with the participants. I'm going to stop sharing my screen for now. You will get the PowerPoint, as I said. And I would like to ask the panelists our first question, which is, what surprised you most when you saw the survey results? Is there anything that was particularly unexpected? Georgia, would you like to kick this off?
Hi, everyone, and thank you for having me. Yes, sure. So for us in country office in Malaysia, I think one of the things that stand out immediately is, the lack of understanding on how severe COVID-19 is as a disease. The results. So first of all, the survey was done in May and conducted throughout May and June. So when we got the first responses, we saw that 79% of the interviewed people consider COVID-19 is not dangerous, while only 18% consider it as a very dangerous disease. So initially, this was very alarming in light of our all communication efforts that we have done at the moment. And but once we look at actually the demographics, once we look at the data, and once we have contextualized it, it kind of actually made sense as well, because I think it's important to know that there was a specific case in Malaysia that 87 of the respondents were between the age of 18 to 59, which means that they fall under the category of not at high risk. And out of those, some 60% were youth, meaning from 18 to 40 years of age. So this obviously kind of created imbalance in the age distribution surveyed, but it clearly communicated to our office two things. One, primarily that there is a lack of knowledge of the severity of the disease. Two, that we have clearly not engaged enough with the youth. And I think this speaks to a broader picture, because globally, I think since the onset of the pandemic, we've been communicating that COVID-19 is mostly dangerous to the elderly, to those with comorbidities, and so it was probably perceived with with this particular group, I mean the youth, that it's less dangerous, and created kind of this overall, I think, attitude that I'm young and I can't get sick and it won't affect me. On another note, we saw also through the survey that regardless of the age group, almost all participants say that they are aware of protective measures. They are exercising protective measures in different settings as well. So this kind of shows that we've created sort of a mass of intuitive epidemiologists who we have given the information on how to protect themselves, who they apply as well, but they somehow lack this knowledge actually of how how severe the virus is. So for us, this is something that we needed to tackle on head on right away. Over to you, Viv.
Thanks, Georgia. That's really interesting, and also kind of alludes to one of the next questions that I'll be asking further down the line of what we're doing with these results. But for now, is there anybody else from the panelists who would like to add to this? Did you have any insight from the survey that you found surprising beyond the risk perception of youth, for instance, in Malaysia? Katie, perhaps?
Yeah, just briefly, something that was interesting in Myanmar was the difference in recall of different protective measures. The Ministry of Health and a lot of WHO messaging has been talking about protective messages like washing hands, watching your distance together. But the difference in recall between those different messages was massive. 10 times more people recalled the importance of washing your hands, then recalled the importance of keeping your distance. So it was surprising to see which messages are kind of sticky and have lodged in people's minds and have been sort of communicated in that way, and which have sort of slid past, and so that helped to inform our work from there.
Thanks, Katie. Yeah, indeed, that was very interesting to me as well, to see what are the things that we have communicated well and where are perhaps still some gaps left. Did anybody else from the panelists want to add to that?
Hi, Fabian.
Hi, Fajar, over to you.
Yeah, in Indonesia also, I think what surprised me the most is when I tried to connect the survey timeline and result with the data of COVID-19 cases in Indonesia. We did this survey the first time when the COVID-19 curve started to incline in Indonesia. That was the moment that everyone kind of exposed with all this kind of information. So if we look at the information received by community in Indonesia, it was a basic information regarding COVID-19, the prevention measures, symptoms, risk, and what to do, especially what should we do to keep the other people safe. I think it reflects that it is very crucial to share information timely and bring it solely true. So we could use this survey to adjust and adapt to our programs here. Thank you, Vivian.
Thanks, Fajar. That's really great. I'm gonna move to the next question of what were some of the key challenges in implementing the survey? And perhaps Aga from Pakistan Red Crescent, would you like to kick us off on that question?
Thank you, Vivian. Regarding the challenges, as we have employed the multi-method approach in Pakistan to get the information from the community, as we have used both the three methods for the data collection, as face-to-face, online, and through phone. We have had some challenges regarding the participation, to ensure the participation of women, men, and children, as that due to lockdown, and especially the people with disabilities who are not going to move out from their houses. And secondly, the challenge regarding collecting the information from the women, especially in rural areas where we have conducted the survey, they have not, the connectivity of internet was not good enough to get information through online, because so for that we have utilized their family members' phones numbers, and then we have to just get the information from their call. So these are the major challenges. Ultimately, the poor people who have not access to the internet, as the result have already shown that the people with the age group between 40 and with the lowest education in Pakistan are most vulnerable. So these are the people who have not get the actual information not collected, actually were not get involved in that. So to address these challenges, we have taken measures. We have engaged around 49 volunteers in 18 cities at different locations, so they can get the information from the field, from the specific communities. Thank you. Over to you, Vivian.
Thank you, Aga, and great to hear that that challenge was met kind of through the volunteers and really trying to reach out. I think that links as well to the survey findings when we see that you know, in Pakistan, it was, I think, the only country of the four where still nearly 9% of people weren't aware of COVID-19 at that time. And that is, of course, because it is so hard to reach a lot of people. So very good to hear that you're kind of trying to address it.
Just
Yeah.
add one additional point. The major thing we have find out, the major risk we have find out, there is a correlation between the level of education and the awareness. The people who are less educated have less awareness about the COVID-19 and can't know about the precautionary measures of the COVID-19, specifically in Pakistan. Thank you.
Thank you, Aga. And indeed, that shows us once more that we really need to tailor the way that we engage communities so that it fits different sets of people within a community. Katie, I know you also had a challenging context to collect data in Myanmar. Would you like to add a few points to that?
Yeah, it's always challenging doing face-to-face surveying, even in Myanmar with the poor infrastructure and access. We were lucky because at UNICEF we had funding to do this as a phone survey, and we contracted a research agency who have a panel of respondents across the country. So that was a great sort of head start for us, and meant that we could survey not just people online, but also people who we could speak to over the phone. Some of the challenges of that were that we were relying on this panel, which was slightly biased to more educated urban respondents. So the representativity wasn't perfect, or lesser educated and more remote people were underrepresented. I think it's also worth noting that that this was a multi-country study and we were coming together to do it. And there is huge value in that, but it does come with some challenges. Like, as the countries, all of us panelists, we had to agree on the same questionnaire, which we all did. And of course, there were some times when we wanted to tailor a question to a Myanmar context, like different education levels or something, but we, as a region, needed to standardize those. So it's hard, and there were some sacrifices there, and sometimes we wanted to have our own way a bit, but the value in coming together and making a few compromises is huge. Now we see Myanmar in the context of the region, we have our shared dashboard, joint advocacy. So yeah, the challenges paid off in that respect.
Thanks, Katie. Those are really good points. And to kind of follow up, you touched on, you know, who was excluded in the survey as well. And I was wondering if Audrey, you would have something to add that, like, what were the gaps in terms of who we talked to in the survey, and what should we change?
Yeah, thanks, Viv. So as Georgia highlighted just now, a lot of our respondents were in the low risk group, so under 60 years old. And so the 60 and above age group actually will consist only about 7% of the respondents, which is a very small amount in comparison. And so that clearly is a exclusion risk. And so part of it is because a lot of our enumerators are volunteers in the Malaysian Red Crescent. And they were also of the low risk group, sort of the youth. And so what tends to happen is that they kind of ask and interview people of their age, and they're more similar to them. And so we realized later on, after collecting the data, that is a gap that could be addressed in the second round. And I think part of what Katie and Aga also highlighted just now about the urban-rural dynamic and sort of targeting people in the cities and doing it remotely is also an area an issue with Malaysia, because a lot of the respondents are also from urban city areas. Only about 23% are actually from rural areas. And so that's another area that we are planning to address in the upcoming revision of the survey. And some other things that we didn't collect, for example, ethnicity data, we didn't really collect. But we predict that indigenous groups are not really represented in the sample, which is important to know because that we don't really have a lot of data on them. And also we didn't collect any pre-existing health conditions, which would be good to have to understand the perceptions of people at high risk. Beyond the age, there are other factors for high risk as well. So this is a consideration that we have for the next survey as well. Yeah. Over to you.
Thank you, Audrey. I think those are really good points. And I'm interested to know a little bit more. So I think one of the solutions in a way that we've found and agreed on was to adapt the second round of the questionnaire to collect different data points so that we can also present and understand who we've talked to and see who we haven't talked to. I'm interested to know as well, what are kind of the tips and tricks that we can use in order to reach those that are not in the, let's say, younger part of the community. Perhaps Audrey, if you want to add to that, or any of the other panelists as well, of how do you plan to address this in the next rounds?
Yeah, sure. I'll just go quickly. I think one of the things that worked well in Malaysia, we managed to collect double the amount of survey respondents than originally planned. Part of it is because we integrated the data collection with our existing activities. So it wasn't out of the way for a lot of volunteers who are already doing activities, doing health promotion, community engagement, going to hospitals to provide assistance as well. So that was very useful because it was, we managed to engage a diverse group as well in those places. At that time in Malaysia, the caseload was quite low, so we were able to do kind of have physical engagement with physical distancing. So we were able to collect a good amount of data. So I think integrating the data collection with an existing activity is a important step, and to be able to target the different groups. The other thing is that we realized that it was necessary to continually update the enumerators as well on the status of the data collection in terms of the demographics. Because it was a 2-week data collection period, we were able to see over several days, right? Like every day, how many people were collected and what kind of demographic group they're from. So it's important to kind of update the team of enumerators that, okay, this is the kind of demographic group that is missing. Can we collect more of that? That kind of communication within the team itself is important so that they're able to be motivated to collect from certain groups as well. I think that's the other thing that is really crucial that we're going to adopt in the next round. Over.
Thank you, Audrey. And yes, agreed. It's also about diversity in the team, but then, kind of giving the motivation that they reach out to different groups as well. Did any of the other panelists want to add to that? Yes, yeah, go ahead.
Thank you.
Georgia.
So just to complement what Audrey was saying, also I think that the main challenge is the outbreak itself and the dynamics of it, right? Because, for example, for us in Malaysia, when this was actually being conducted, it was, like I said, May to June. And, some of the states, as Malaysia has many states, some of the states had almost none cases, right? So also people might have been, answering from a perspective or with a false sense of security in a way, So I think it's an equal distribution that has to be somehow balanced throughout the survey is what is needed or what we recognize maybe as an area where we need to, have the survey more flexible to kind of meet all these needs. And also, Malaysia is such a diverse country with so better ethnic representation and ethnicity, like Audrey said, is definitely something that we want to look into with the round 2. But as we mentioned, round 2, and this is scheduled for mid-November, we already have now a surge of cases in Malaysia, and we already have some states that have movement control orders. So this all poses kind of a challenges for further implementation of the survey. But what I think it's important for everyone else on the call is actually to understand that this survey is very flexible and the methods are very flexible, and it can be easily adapted to as the situation evolves in countries as well. This was at least our experience so far. Thank you. Over to you, Viv.
Thank you, Georgia. And yes, indeed, there is a certain flexibility to it, and also, of course, required from all of us in these rather, interesting times, let's say, to address these challenges that COVID-19 is kind of continuously throwing at us. Did anybody else from the panelists want to add to that on how you wanted to, change or address gaps in the next round of the survey?
Thank you, Vivian. I just put some update, some additional point, as my colleague had already discussed. The point we have realized during implementation of the first round of the COVID, the perception survey in Pakistan, the methodology need to be clear and need to be aligned with some of there is a flexibility to use this methodology first. And the second thing we have realized that the collection of information, real-time information collection, is difficult in some areas, as we are talking about the rural the areas or the cities where the connectivity issues and the internet connectivity issue is also challenging for our volunteers who are collecting face-to-face information. So we need to we need to address this challenge through building the survey on ODK, offline ODK collect form. We can adopt it through this tool, so it can easily be collected from the field directly. So that can be updated later while editing, and so there's some improving the comment as well. So that can also ensure the reliability of the information and the quality of the information they have collected in the field. That finally, just through as we have experienced through utilizing the local volunteer is more value addition to this survey. So if we are conducting the survey through our local volunteer, they can collect from the field directly. The major challenge need to be addressed in culture, like in some in some areas where some culture norms to collect information from women directly is difficult. So for that, to collect the offline, to download the offline form of the survey, and if we can collect it from the field directly from the women as well. So it can ensure participation of women, men, and children, and the poor and the most vulnerable through adopting this method. Thank you, Vivian. Over to you.
Thank you, Aga. The connection was a little bit unclear, but because we've talked before, I think I can summarize a little bit what you said, which was that, there's, of course, a lot of challenges to collect this data, and particularly from women. So we really need to make sure that we kind of are aware of the cultural context and the local context. And one of the ways that Pakistan Red Crescent has addressed that is to really put in the boots on the ground and to print out the survey on paper and take it with them to people directly in order to capture their voices. And that is, of course, a great effort. And in some areas we just can't get anywhere with only relying on digital. I hope that kind of captured it well, Aga. Thank you. Okay, I would like to segue us to another question, unless Fajar, you wanted to add something? Go ahead.
Yeah, Vivian, just a short one. I think collaboration is a key. I think collaboration is a key. I think it could make the survey more efficient and effective. Bear in mind, there's so many surveys going around online. So if we share same objective with maybe in the working group of community engagement. I think it's also like reduce the assessment or fatigue in the communities.
Thank you, Fajar. That was the perfect introduction to the next question I wanted to ask all of you, which is what kind of coordination did you do with other partners in terms of the data collection, but also perhaps joining efforts, sharing some of the burden of reaching really everybody in the country. Katie, would you like to kick us off on that?
Yeah. So in Myanmar, we have a active RCCE working group with about 30 UN agencies and organizations on it. So we've been discussing this questionnaire, this survey together with them, and the Ministry of Health are also sitting on there. So we really tried to have it as this collaborative effort with different people putting in inputting at different stages in the process, which meant that people felt much more ownership at the end. And one of the key collaborations within that group was, as I mentioned earlier, in our phone panel, we had an underrepresentation of those people in more remote areas, and particularly in humanitarian settings or non-government controlled areas. And WFP, the World Food Programme, have big contact lists of beneficiaries, names and phone numbers. So we partnered with them, and it was sort of quite a legal process. We did privacy impact assessments and data sharing agreements, because of course this is the data of vulnerable people, and we couldn't sort of be throwing around these big Excel sheets with people's names and phone numbers. So we worked together with them, with lawyers in both of our headquarters, and set up a system to securely send these contact details between the two organizations. And it was fantastic. We could then share back with WFP and all these partners the data we can get from more remote communities. I would say it wasn't easy. It took quite a long time getting these agreements in place, and sometimes it didn't feel worth all the emails and calls with lawyers. But really, those are people whose opinions and perceptions are very rarely covered by surveys. So if it actually felt like this sort of very difficult, constrained situation had in fact pushed us into trying even harder and getting sort of reaching and surveying people who wouldn't usually have been reached. So that was a really productive collaboration in Myanmar.
Thank you. And just to follow up, now that you've done all of the hard labor of getting, the whole structure in place in terms of data protection, which is of course incredibly important, especially in a context like Myanmar, do you feel that now that's easier to kind of collaborate with others to collect this type of data?
Yeah, I mean, there's certainly been a lot of that work won't be undone. We were even in a webinar, a sort of legal webinar for the whole of UNICEF recently, to share this practice and to help these kind of processes. So definitely, although the negotiations can be quite painful when they're laid down, things can happen more easily in the future. So yeah.
Thank you. That's really encouraging to hear for everybody, I think, and well done on making that happen. Did any of the other panelists want to add a bit more in terms of coordination with other partners?
Oh, George, you can go for first. Yeah.
That's not a problem, please. Go, Audrey. No.
Yeah, no, I was just going to add that definitely the RCCE working group in the country and regionally is crucial for regular communication, regular coordination. I think I just wanted to add that the government, the local government especially, is also a crucial partner in collecting data and also in advocacy in using the data as well after you've collected them and analyzed them. And so we really depend heavily on the existing network that Malaysian Red Crescent had with the local government through its offices and through the dialogues and with the government. And I think that is important to have access to the communities as well, and also to identify certain groups that might be underrepresented. So in subsequent surveys as well, it's important to engage them so that they're included, because ultimately the government is also an important stakeholder in terms of the results that we have in terms of changing the communication strategies or changing ways of working to keep them informed as well. Yeah, so I think that's an important addition that I just want to add. Over to you, Georgia.
Thanks,
Thank you,
Audrey,
Audrey.
indeed.
Yeah, I think you've covered actually most of what I wanted to say, but just two things. Like in Malaysia, we have pretty much the similar setup as in Myanmar. We have the UN RCC working group with INGOs, NGOs, the government sitting there, the Ministry of Health, and so on. So it was very important that this is all communicated early on with them, so that the data could be later on integrated into the response as well. And but also think that the survey itself is a platform collaboration. Connecting UN agencies with IFRC, with MRCS as well. I think it's been an interesting process so far. Over to you.
Thank you so much. And yeah, I think it's really an exercise in interagency collaboration and partnership where we've all learned a lot to work together. What can we do better for the next rounds? Which things went really easily, etc. Aga and Fajar, did you want to add anything in terms of collaboration?
Hi, Viv. When we collaborate with other partners, we identify the opportunities and how are we going to share the results. So I think that's kind of our approach to collaborate with other partners to reach bigger audience. We ensure our partners what is the objective of the survey and how it benefit them, that we will share the result to them so they can also adjust. They can use the result of the survey to adjust their program.
Yeah, similarly, we have coordinated with our partner. We have shared the survey finding with our partner, and we have adjusted some of the actions in their planning as well. So we have recommended some, based on the discussion, we have recommended some actions to implement immediately during the implementation of the COVID response. Thank you.
Thank you, Aga. And again, you did a great job. And now you introducing the next question, which is what kind of actions have you all taken based on this data that you've collected and analyzed? What is the follow-up? How are you closing the loop, so to say? Perhaps, Georgia, did you want to kick us off?
Sure thing, Viv. Okay, so maybe just to give a bit of a background, so we work under the Asia Pacific Strategy for Emerging Diseases and Public Health Emergencies, which is a document that basically urges countries to do two-way communication to establish mechanism for dynamic listening. So naturally, WHO country office in Malaysia, Brunei Darussalam, and Singapore welcomed this opportunity to do a survey. And we're doing this one, but we're also doing behavioral insight survey, we're doing social insights, and many other things as well. For us, like I mentioned in the beginning, for us, it was important to address the gaps within the survey we saw immediately, and that is basically to, particularly enhance our community engagement with certain group, and that is the youth in this case. So what we did with the data, right on, first of all, we refined our risk communication and community engagement strategy of WHO country office. But we also made a strategic plan, another one on how to engage youth in the COVID-19 response. And, as I mentioned, this was done, it probably ended in June, and then we analyzed the results in July. But basically, we understood that there is a good opportunity already to to communicate with some of these audiences, especially with adolescents, the pupils, students, and so on, because we were entering the month of August and September when we have the return to schools. So we launched the campaign right away. That was called Be a Superhero. And this, for example, went beyond Malaysia. The video went viral. We did some animated videos, and they garnered over 40 million views, and within a month, just on WHO platforms overall. And I'm happy that also now the MOH has actually took the ownership of that campaign, and now it's a national campaign in Malaysia as well. But also we did a couple of other things, and speaking of collaboration that you have just mentioned and that we talked a bit, we of course presented these results to the working group. And we've, in particular, so we're thinking which partners we can use to address and develop certain IC materials and so on. So we naturally partnered, for example, in this case, with UNICEF, and we did together a whole set of informational materials for back to school, kind of back to universities program, where we targeted not just school management and kids and students, but we also targeted parents and teachers, as they all play a part in this, right? And another two things that we're of course now developing a strategy that goes beyond 2020 and looks into 2021, and in terms of like how we can engage more civil society organizations, how we can engage more youth organizations within the response and give them an ownership in the response as well. And we're looking into different innovative ideas through social innovations, through crowdsourcing and so on. But two things that really I would like to highlight here as a good tool, how you can use this data. One is, you can successfully advocate for more funding. If you're, for example, a country office, or, you even a regional office, but this is a good opportunity. This data gives you really, other than, of course, informing your response, it gives you really a good opportunity to advocate for more funds and for more projects, which is exactly what Malaysia country office is doing. And then another one, of course, is, to enhance this overall collaboration with your counterparts, with the government, like we've discussed, sharing the data with them, so we would have, informed response, and we would, streamline our activities jointly. So I think these are some of the initial steps that we have already done, and we are of course preparing for the second round of the survey now. I think it's important also to look at this data, and I think, working with this platform, you can, as a country, really fine-tune both the methodology and the questionnaire itself, and then move on to the next round. That's in short. Over to you, Liv.
Thank you, Georgia. I think you summarized really nicely some of the actions that can be done, but also the advantages of doing something like that and doing it kind of as an interagency survey, I guess, even though, of course, the first round is always going to be the hardest one, where we learn the most as well, I guess. Fajar, did you want to add something to this question? I know that in Indonesia, you've also used this data really heavily in terms of, how you're interacting with partners, and how you've changed, or how the Indonesian Red Cross has also changed its approaches.
Thank you, Vivian. Yeah, tooling back with what I've shared before about the survey time frame and the beginning of COVID-19 curve in Indonesia, we could take action based on the result, and we gain a lot of insight from the community on specifically on their preference in communication, about their communication channels. We utilize preferred channels to reach wider community, from PSA in national television, in radio talk shows with various topics, the power of time scroll or social media. We use a lot of social media as well, but we adjust the topics according to the feedback. Having a correct and a valid information is very crucial also, so we could develop a better frequently asked question to be shared to our volunteers and staff, particularly on those who responding to feedback and working in managing feedback with the communities. I think that's how Indonesian Red Cross here take action based on that result. Thank you.
Thank you, Fajar. I know we also have Carl Das in the participant list here. We weren't sure if he was going to to be able to join, but he's here. And Carl, would you like to say a couple of words on what Malaysian Red Crescent is planning to do based on the survey results?
Oh, hi, good evening. Sorry, I got my time wrong. I thought it was 9 p.m. Apologies. What at the moment,
we can't hear you right now. Can
you hear me now?
Yes, now you're loud and clear. Go ahead, Carl.
Hi, good evening. Thank you for having me. There are two things we're focusing at the moment. Or do I need to have the video on? Sorry. One of the things that we're going to work with one of our very progressive states, Kelantan. We're going to start doing some videos for social media. We're going to do some live videos using our Youth 100. And also the other thing we are also doing is getting some materials that we have used in the past and sort of rejig a bit and start using those materials and not reinvent the whole wheel. So these are the two areas we are going to do immediately. Yeah. Thank you.
Thank you. Thank you, Carl. And good to see kind of the strategic mix of doing, on the one hand, something with the volunteers, but also using social media to reach kind of different types of people. Aga, did you want to add something in terms of how you've been using the results and how are you closing the loop?
Thank you, Vivian. We, based on the result, we have, as I have discussed, we have discussed the result, the findings with our partner. Based on the discussion, we have come up with some messages to inform the communities about the COVID-19 and it spread. And so on that, we have utilized our field volunteer. As I have discussed, we have conducted this surveys in 18 districts, in 18 cities. So we have utilized the 18 cities volunteer. We have conducted this awareness session with the support of ICRC. In the 14 days, we have conducted awareness session through announcement through mosque and the microphone announcement through a public conducted in a public places. So we have tried our best to inform the public about what are the channels they are very trusting, they are mainly trusting, like the mosque, the loudspeaker from the mosque, the announcement are very, very known and in a local language, so the people can better understand and apply. So we are trying to integrate. We have done a lot of announcement till now, and we are also continuing it till. Okay, over to you.
Thank you, Aga. And great to hear that there's also been like a diversity of activities based on these findings. Now, I would still like to hear from Katie as well on what you have done, but just very briefly, and would also like to ask all of the participants to share your questions, because after Katie has given us a brief overview of what they have done with the results, we would really like to hear from you and answer some of your questions. I'm already monitoring the Q&A chat here, but feel free to use that or the other chat box to send us questions, and I'll try to pick up as many as possible. Katie, over to you.
Yeah, well, I'll speak very briefly so we have time for questions. One of the sort of neatest for us ways of closing the feedback loop, in the questionnaire, we asked people what type of information do you want? And one of the most popular mentioned topics was about their children's education, as George also mentioned. So that was simply getting that data, sharing it with our education team, sharing it with the Ministry of Education, and quickly coordinating those people and that team then have taken the data and created some animations which have gone on national TV about supporting kids' education. So it's not, just to make the point, it's not just about us as an RCCE team doing everything, but also getting information to the right people who can then run with it. We've done that in a few other ways as well, but I'll leave it there.
Thanks, Katie. I think those are, yeah, it's very important that we don't just see ourselves as in a little vacuum of RCCE super fans, but that it really is something that needs to be mainstreamed and where we need to pull together and make it into a team effort to be able to close the loop. So that's a very valuable point, I think. I see one question in the Q&A, which is for Georgia, asking, Tembisile and Humbela is asking, Georgia, did your strategies work in engaging youth, and what were some of your challenges?
That's a very good question. Now, first of all, the campaigns and overall the projects are still, some of them are in initial phase. Some are about to be enrolled only now, November and December and so on. But the materials that we have produced so far and the campaigns we have produced so far, like I've mentioned, we've been very successful because we looked at low cost, kind of high impact tools with only one animated video over 40 or 30 seconds. If you can reach out 40 or 50 million people, and for them kind of to share that among their audiences, that's fantastic. So as a country office, we don't have much resources, so we work with a very small team in our office, and basically we produce all the content as well. So we kind of have to work with what we got, but I think we've created a lot of actually tools that are specifically tailored to a specific group, of course, and these are, in this case, the youth, in case of Malaysia, and so far that has been working quite well. Also, what I think it's important step that all of us have to make in general in communicating with youth is this directive messaging, which in fact we now know that it's not working. I mean, name one young adult that likes to be told what to do. And in fact, on the other side, we know that they know the preventive measures. We know that they practice them. At least that's the case in Malaysia. But that's why I'm saying, we need to step away from this directive messaging and then look at empowering models of communication and see how we can integrate them to our strategies and programs within the response, give them the ownership. I think that's my best advice that I give to the colleagues. Over to you.
Thank you, Georgia. And yeah, indeed, a tough question that you answered well. In the chat, Pooja is just sharing that they also conducted a perception survey on urban slums in 10 cities of India. And one of the fallouts was also emerging domestic violence. So they started conducting telephone interviews and submitted that report to the Ministry of Women and Children in India. And I think that is a really good example of how this data can be very impactful, and how important it is for us to collaborate with governments as well as other organizations in order to kind of be able to address all of these findings and address the challenges that we're seeing as well from there. Thanks. Are there any other questions or also perhaps knowledge sharing from any of the participants?
Viv, can I jump in?
Yes, please do.
I've just seen earlier in the chat, Tara sent a question about why the death rate in Myanmar is going up now and whether the survey can help to answer that. It's a really difficult question. I'm sure a lot of countries are asking the same with the surging cases that they're seeing now. I think in part Myanmar, when a lot of other countries were having the first wave, it coincided with the Buddhist New Year festival, where traditionally the country completely shuts down for a week or 10 days and everyone is home and all the shops are shut. So when that first wave was there was very good stay-at-home compliance, which perhaps helped Myanmar to dodge that, to dodge those cases. and now life has returned to normal, has been returned to normal for several months. But your question was, what could we see in the survey? And we could see in the survey that there was, as I mentioned before, very low awareness of the importance of keeping distance and isolating people at risk. So we could see there was very little practice of that, even when the cases were low. And now we see a huge uptick in cases. So I don't want to suggest causation or correlation too strongly, but it's, yeah, that we can certainly make those observations from our data. Thanks.
Thanks, Katie. And indeed, these are, it's really important to look at the data and kind of see what else can it tell us, rather than just looking at the direct answers, but contextualizing them a lot. There is some more questions. So there is one question in the Q&A chat asking that, first of all, a very simple one that I'm going to answer right away from Dr. Tan from Vietnam, whether we can share the recording and written transcript of the webinar. Absolutely, yes, we will share that with all of you. And also, there was a question earlier about getting the questionnaire. You're very welcome to get the questionnaire, of course, and we have translated it into a lot of languages. The first round, the second round, we're hoping to translate further as well. And we're, of course, very keen to work together with others. There's one question from Mark South, whether we looked at disabilities at all and whether these were significant factors in influencing access to information, awareness of COVID-19 and prevention measures. Did any of the panelists want to take that question?
I can take one. That.
I was going to give it to you.
So
Perfect.
in the first, So in the first phase of the survey, it was really a test, right? So we realized that was a gap for obvious reasons. So that is, as you rightly pointed out, it can affect based on our assumptions. And so after meeting with several different people who were involved in the survey, we've amended it for phase 2, which does have a question on this, not just on disability, but also on whether the respondent has chronic disease, whether the person is pregnant or breastfeeding, and whether the person has any mental health condition. So these are just some of the, and also an option for other, of course. So this is just a simple question to be able to identify some constraints to a person, to the respondent, that could possibly affect their responses. And also just to add that we do want to keep the survey, while we want to have good data from it, we also don't want to encourage response fatigue. So that's why we try to keep it under 30 minutes as best possible. And so while there were many questions that we wanted to add, we try to keep to the ones that are really crucial. And so this is one of them, actually, the disability and the other constraints one.
Thanks, Audrey. Indeed, this is the revision that we did for the second round of the survey, where now we're giving more opportunity to show that as well, and was definitely a gap. I have one more question for you, Audrey, if you would like to answer that, which is on the sample size. And so there was a question here on giving a little bit more information on how we decided on the sample size and agreement about sampling strategy, which comes from Paul.
Yes, I hope you can still hear me, because I think my bandwidth's pretty low. So of course we do want to keep it, I mean, we do want to have a significant sample size as best possible, but given the different circumstances in each country and the different constraints, for example, how many volunteers and enumerators you have, what kind of, and whether they are trained as well in collecting data, and whether they're trained in community engagement. These are some of the criteria that we look at. And so I think we wanted to, especially after the first round, now in phase 2, we do want to target certain states and certain demographic groups that are missing. And so while the calculation might not be as, I guess, stringent in terms of statistical standards, but I think a lot of times when we decided on the sampling size, it was really based on the capacity of the institution, of the agency. So for in this case, for Malaysian Red Crescent, whether they are able to do it, and whether they're able to also speak the local dialects and speak the local languages. I think those are some of the really crucial constraints. We decided in the end for the original target was just 1,000 as a comfortable start, as a test, because it was a pilot as well. And for the next round, we will have to revise that based on what we're able to do missing. Yeah. Over.
Thank you, Audrey. I hear somebody else is unmuting themselves.
Yeah, just to add some point regarding the sampling methodology. So the sampling methodology, we have calculated the sampling methodology based on the proportionate to the size sampling approach, and the method we have used, the convenient sampling method, to conduct this perception survey, because there is no other method can be justifiable in this condition due to travel restriction, due to movement restriction, and so many other things. The secondly, as we discussed, the proportionate we have taken from the sample sizes, we have taken a 95% confidence level, that we have 95 and 5% margin of error to calculate this sample size, and we have just put that the more sampling, as we have calculated, it was around, in case of Pakistan, we have 485 sample unit to collect during the out of the total population. So we have just justified that the more sampling size is the less margin of error. So there we have built a correlation to ensure the authenticity of our information, that the more information if we have collected, the margin of error in our sample unit is less. So it was the approach we have utilized. Over to you, Vivian.
Thank you, Aga. Indeed, this is been quite a challenge to collect data during a pandemic, and somebody in the chat box was actually asking, when is the best time to do the survey during the pandemic? That's from Tilaka. And the answer is kind of at any point or never, in a way, because it's always going to be such a big challenge, as Audrey and Aga just described, that there's no point necessarily in waiting too long, because it's so unpredictable what will happen, of course. I'm just posting into the chat box as well for you the link to the dashboard of the data and the test survey round 1, because there's been a number of questions for the questionnaire, or and also for the data to look at that. There is still quite a few questions that we haven't answered yet, and don't worry, we have some more time to answer questions, but in between we would like to ask you a question as well, which is, if you have used perception data so far as the audience, what have you used that perception data for? So we will have another quick poll. So have you used perception data to change programs, to reallocate funding, advocacy, answering questions, context analysis, designing messages and materials, or something else? And of course, not everybody might have used perception surveys, so feel free to skip that question if you haven't done that yet. But for those who have, we'd be really interested to learn about how you've used it. So we can see quite a number of people say that they're using it for context analysis. And I think kind of in second and third place is at the moment advocacy and designing messages and materials. Yeah, so it's slightly changing still. Okay, so I think we have a clear winner with the context analysis. Indeed, that is the preferred choice, like 58% of you are using it for that. And then on second place, so to say, we have designing messages and materials, and on third, advocacy. Of course, that highlights the kind of that perhaps it's quite hard to change our programs, but this is of course one of the key things that we also want to be doing with this kind of data. And yeah, I think it shows a really interesting overview of what we are using it for at the moment and how we can maybe expand even in order to bring this data back to the community and not just collect it and kind of keep it for ourselves. And I think the panelists shared some really interesting examples for that. I have a final question for the panelists, and then we will get back to all of your fantastic questions from the audience. And my final question for the panelists is, what would be your top recommendation for the next round of the survey, or for other people who would want to implement a survey such as this? What is your one key recommendation? I will ask all of you, but I will ask all of you to just give one so that we have a bit of diversity and something interesting. Katie, would you like to kick us off?
Yeah, and mine actually feeds straight on from the last poll question, which is when you're setting up the survey and before you start, make a clear plan for how you're going to use the data. Because there's so much involved in doing the survey at all, getting the findings, making the reports, presenting them, but still the job isn't done. And as you've just said, Viv, like actually encouraging colleagues to change programs, to work out how to channel the different pieces of data to different decision makers, it's really key, because just having the data out there isn't organically, naturally, in my experience, going to change a lot. There's almost half the work is to be done afterwards to really get that data to be changing things and influencing people. So having a clear plan for that, I think, would be my key recommendation. Thanks.
Thanks, Katie. Having a clear plan, indeed, very crucial. Fajar, would you like to go next? What is your one recommendation for others, or what is the one thing you would do different in the next round?
I think perception survey is like solving a puzzle, Viv. So I would like to recommend to try connect the survey result with other data, not just to triangulate the data itself, but to make it richer, so we could adjust our intervention better.
Thank you. That's a really good point as well. So using really all the different parts of data that we have.
Yeah.
And I think especially in a pandemic, that is very important, because our data will not be as rich perhaps or as easy to get as we're normally used to. So very good advice. Audrey, would you like to follow?
Yep. So I think one key thing that we really learned that from collecting the data is that to really allocate sufficient time to translate the survey questions, to train the enumerators, especially to conduct the data collection remotely, given the situation right now in Malaysia and in many parts of the world. So because the survey, when it was crafted, it was designed in English, and then it was translated to different languages. So it's really crucial to really get the context, the questions contextualized. For example, there's a question on education. Originally, it was number of years, and then we had to contextualize that into secondary school, primary school, high school. Like there are different ways of defining what education level is in each country. So that is really needing to allocate time for that, and also to train the enumerators so they're comfortable with the questions, because they're really your first line of defense. They're the ones who are going to collect the data, and you want the data to be as good quality as possible from the very beginning. If not, tainted data and unclean data can be it's really not very useful later on when during analysis you can see the gaps. So I think really allocating enough time to do that, and also to do it remotely, and having a remote strategy to collecting data is really crucial during this time.
Thank you, Audrey. I couldn't agree more. The preparation is really key here. And also knowing that we might have to train enumerators online, adds yet another layer to that. Aga, what is your one recommendation that you would like to give participants on doing a survey like this?
Based on my experience of conducting the COVID-19 perception survey in Pakistan, I fully recommend to clearly design your methodology. Once you design your methodology and sampling method, who you will collect the information and where to collect, what are the approaches you will be used to conduct this survey. So once you clear the method, you are easy to collect the information and the approach, who to collect. And we have used only one method in this survey, which is convenient sampling approach. So I fully recommend to use multi-method approach of sampling as well to get more information, accurate information, and involve communities systematically and ensure their representation as well. Thank you.
Thank you very much, Aga. And George, last but not least, what is your top recommendation for the participants?
Yeah, thank you, Viv. I think I have two. I just want to go back for a second to the question on when to do a perception survey. I think the proper answer would be frequently. That's one thing. And then the second thing, I think COVID-19 and also all the emergencies have, highlighted from a broader perspective, highlighted the need of social sciences and the application of social sciences in the response. So I would say to my colleagues to make sure that they include, sociologists, anthropologists within their teams, because this is the work that clearly, I speak on my behalf as well, that clearly goes beyond risk communications per se. So I think allocating funds and budgets and including, social sciences within the response, I think that's my overall message. Thank you.
Thank you, Georgia. And Carl added something very similar in the chat, that his recommendation is also to very similarly, look at the roles that are required to manage a successful survey, and kind of who does what are the expectations, etc., which I think are all very good lessons learned. We have a couple more questions from the audience, and then we have after that, I will ask for a final question to the audience, and we'll wrap up then. So I would like to go back to some of the Q&A questions that we're seeing here, and hand those over to the panelists. So there was a question for Katie, I would say, which is about, no, it was actually a question not for Katie, because it said, outside of Myanmar, where a local agency was used with a standing panel, how were phone numbers obtained for the respondents? Audrey, would you like to answer that question in terms of how did they call people on the phone?
I would say actually a lot of the people that we engaged were through the networks, our volunteer network. So really the advantage of the local Red Crescent is that they have a very strong community network through the volunteers, through the branches. And they also engage the local council, the local government to kind of advertise this as well. So I think that is probably why we had representation across different states. So we really engaged them locally instead of, I guess, like pasting a link online, which can be helpful to target urban areas and city areas. But what was interesting is that because of that strategy, our respondents did not really skew towards the capital city, which is what I expected originally. In fact, the capital city, Kuala Lumpur, was only, I think, 5th or 6th, like most represented state in the whole sample. So I would say, for data protection reasons as well, we really engaged through our existing network. And so a lot of the volunteers engage their peers, engage people in the community that know their neighbors, and that kind of establish a rapport as well, which is very good for interviews and collecting data. And so I think that kind of also highlighted a need for us to train the volunteers on data protection and how to protect identifying information, so that in the future that doesn't, it's not a problem as well. Well, given the COVID context, I think that strategy might have to change a bit while we still continue to engage our local networks. But we might want to kind of go to local governments to ask for different contact numbers and things like that. And that would really need to have a strong data protection strategy and policy in place to be able to do that. Sure.
Thank you, Audrey. That's very insightful, I think, on also how we need to adapt going forward. There were a number of questions that were related to each other. One was, why did we choose those 4 countries? And another one was, is there any plans to do a survey in the Pacific region? And I'm going to answer those right away. So one is the 4 countries were chosen because they stepped up. We kind of, through the regional risk communication and community engagement working group, and through, the kind of lead agencies here, we've been reaching out to people, and these countries that you're now hearing here are the ones that were interested in doing the survey. So for the second round, we're really keen to work with more countries, and there has been interest from various organizations. And of course, if you know anybody who is in the Pacific who would like to do this kind of survey, we're really happy to work with them. The second questionnaire is available, and you can either use the joint Kobo form, which is then in a way serviced by UN OCHA and goes automatically again into a dashboard. So you have a certain level of IM support that's included in that package, so to say. But you can, of course, also clone that form and do it yourself, as long as it's being done and addressed as well. I think we're good. There was a question that connected to that as well, on whether there's any plans of doing the survey in other Asia Pacific countries. I think that's I just answered, and the same attendee asked whether there would be localized surveys of that. We have seen that other countries have done the survey individually as well. So for instance, in Mongolia, the Mongolian Red Cross has been doing a survey themselves. And we've seen in other countries as well that other agencies have done the survey. So, which is great to see. I think it's really fantastic to see that we're more interested to hear from people and also responding to them. There was another question from Johnny Lam Kai Loing, asking that you indicated something very interesting out of the survey among the 18 to 44 age group, if I heard that right, related to a perception of no fear towards COVID-19. How do you think that can be improved, as it is almost the same in many parts of the world, especially among the young? Thank you. I think I'm gonna pitch that question actually to perhaps first Katie, because I felt we got not quite enough time to say what you have done with all the survey results, and you had more to say. So would you like to answer that question?
Yeah, we So first, sort of more broadly, we recently were talking with a behavioural insights team. They came to present to our national RCCE group, and they were showing some examples of actually from the US, some communications which have gone out targeted at this age group, and particularly of young men, who I think often in many countries are the ones who are have the lowest risk perceptions. So some of their communications, which I was really impressed with, were sort of showing images of young men in the sort of places where they would often hang out, and some of them had little annotations of each of the guys in the photo who are hanging out watching football together, saying, this guy is about to visit his grandma, this guy has COVID but doesn't know, this guy. So some sort of clever, fresh, engaging pictures showing how young, healthy looking people are actually at risk of spreading the disease, suffering themselves, or spreading it to their families. In Myanmar, our research is often showing that young people aren't scared for themselves, but they are scared for their families. So we've been working with the U Reporter Network, which some of you might have heard, a big network UNICEF runs of young people, and building on these ideas, talking about these ideas of sort of protecting your family. It's not necessarily about you, it's also about protecting your family and people who are more vulnerable to this disease. And our U Reporter teams have been doing some great things remotely, mini music concerts they've been doing in evenings, discussion forums on topics which people on Facebook polls have been voting for. So yeah, I saw somebody mention humour earlier, trying to use things like humour and fresh ways of communicating that make these issues seem relevant, not necessarily heavy-handed ways of stimulating fear, but yeah, kind of bringing a fresh perspective. Thanks.
Thank you, Katie. Did anybody want to add to that from the panelists in terms of engaging younger people? Also, feeling very comfortable that if you're mid-30s, we're still grouping them as young. It's great. Okay.
I could just compliment that and say that Katie is absolutely right. I think one of the main theory of change that we are actually practicing within our strategies, looping into that empathy about of course continuing to share information and knowledge and science and data and evidence about COVID and how is it transmitted, as we I've talked about it previously, that was a big issue for us, but also working with youth and looking into, they will definitely change their behavior if they see that their behavior can impact the ones they love, and if they can they might have the attitude I can't get sick, and I'm young and everything else, but if they understand that they can very well bring this virus back to their home, back to their loved ones, they might change the behavior as well. So I think it's pretty much the same model that we have been using as well in Malaysia so far. Thank you. Over to you, Viv.
Thank you, George. Indeed, using kind of different approaches is key here. We have one final question, which is from Christine Richards, whether partnering with mobile phone companies is something that is recommended and distributing the survey through this methodology. Has anybody on the panel looked into that by any chance?
I'll just try to answer this.
Mm-hmm.
We have not tried this approach, but it is the most appropriate approach to be used in this such type of survey. We're just putting a stepping interval while collecting the pupil's phone number from the mobile company. So it is a really recommended approach for conducting this sort of survey. Over to you, Vivi.
Thank you. I don't know if anybody else has looked into this. We definitely hadn't. Katie?
Yeah, we've looked at various ways of working with the mobile operators, but we have found it really difficult. They have quite a lot of demands on them at the minute, with the Ministry of Health have certain messages they want to send. And when we're talking about going nationwide, it's quite a considerable cost to the telecoms operators. And even if it's government mandated, they're not so keen to sort of give it away. So the telecoms here in Myanmar have been doing some great messaging, but we can't have everything we want, so we didn't manage it.
Great, thank you. So something to explore further. I'm going to wrap up now because we're nearing the end of our time. And while I'm doing just a couple of or giving you a couple of words to kind of summarize this session, I would like to ask for the final poll to be launched as well, which is the question on whether you would consider rolling out an interagency perception survey or being part of it, perhaps. Yes, no, and maybe. So did we scare you off, or did we convince you to join the effort, basically, is the question. And don't worry, it's anonymous, so if you say yes, we can't hold you to it. But to wrap this up, just to say, I think, thank you so much to the panelists. I think you did a brilliant job with kind of giving real insight into both the challenges of an interagency perception survey, such as working together with so many different partners, doing this amidst the pandemic when we can't really reach the most vulnerable people very easily. We've also learned a lot of best practices of being prepared well, knowing who will do what, and really closing the loop and making sure that we use these survey results. I'm very delighted to see that most of you say that you would consider rolling out an interagency perception survey. So well done to all the panelists to, while being very honest about some of the challenges, I think also showing that it's really worth to put in the hard work that everybody has. I'm going to hand over to Umbretta Bajo for the last final words, and thank once more all of the panelists and of course also the organizers to putting this all together. Over to you, Umbretta.
Thanks so much. Thanks, Vivian. Thanks, Katie. Thanks, Audrey. Thanks, Fajar. And thanks, Giorgio. This has been, and thanks, Aga. I couldn't see your face. This has been an amazing webinar and so much teaching and learning. And thanks for sharing with all of us. I've learned a great deal and I continue to learn. I think it does show the importance of measuring behavioral and social drivers on a regular basis to really drive our actions, and not only the community engagement approaches, but also really response actions across the board. What we're doing at the global level with all of this, we've learned a great deal from you, because this has been one of the first interagency efforts in aligning collection of data across different agencies. So you've paved the way to something that we're doing globally. At the moment, we're taking all these learnings and many other data collections, and we've defined a framework for perceptions and behavioral data. And we're bringing together all the core indicators, the metrics for measuring behavioral and social changes. This is going to help us and all the partners that will be rolling out future surveys in focusing on the right, asking the right questions and using the right indicators to measure changes. What we've seen are that there are gaps around measuring stigma and discrimination, which this survey has is a variable that has been collected. There are gaps in measuring community empowerment, community engagement, issues of trust. And these are dimensions that we need to learn more about to really shape our action more and better. So if you are interested in what we're doing in terms of defining the indicators and the questions bank, be in touch with us, be in touch with Viv and the team. But we're pulling together resources for the people that are excited about rolling out this perception surveys, so that you have the best standards and the best questions for rolling out those surveys. So thanks again to all colleagues. I'm going to close. We're 2 minutes over time. Thanks for engaging over the past 1 hour and a half, and looking forward to the next webinar and to continue this exchange of experiences and learning. So thanks so much from the Risk Communication and Community Engagement Collective Service, WHO, UNICEF, and IFRC, and all the colleagues involved. Thanks again, and over.